Day.
Michael Cardamone here.
And I'm Holly Strano. And over the past month, we have learned from dermatologist Dr. Lydia Parker that both women and men can really kind of ward off those effects of aging.
And we called it Facing 50 Fabulously. Well, joining us is Dr. Lydia Parker. Thank you so much for coming back on.
Hi, Doctor. It's great
We're really
to see
excited to see the reveal. We'll talk about that in a little bit, but before we start this, techniques. What techniques can really turn back time?
You know, there are a few things that we all need when we're facing 50, or, you know, some women like to start when they're facing 40.
Yeah.
But we need to relax, revolumize, and resurface our face. Basically, to some degree, we need to relax the muscles that make us look like we're frowning and make us look sad. And we need to restore that shriveling up that our face gets, add back a little collagen and volume to our skin. And we need to polish the surface, take away a little sun damage, and that's what makes us look more like we used to look.
Sure. Now, are these things painful?
You know, most everything that we do, you can do while you're wide awake, and we give you a little numbing cream and do what we can to make it comfortable. None of it's major. We're talking about non-surgical treatments, easy, you know, kind of lunchtime types of treatments without surgery, how you can look better. It's sort of often called the liquid facelift concept, where just with, you know, some little injections over lunchtime, that type of thing, you can take some years off.
Well, without further ado, what we're going to do is take a look at what Leslie Pastel looked like roughly a month ago. So we're going to take a before picture. Are we going to? There it is. And there is the after. Leslie Pastel.
Ta-da!
Ta-da! The
So
big
beautiful.
reveal. Yay.
And you do look beautiful.
You
You looked beautiful before.
And
but I mean,
and you know what I said before we came on? And I said to her, I go, I'll be honest with you, not that I can't tell a difference, but the fact that it looks so natural, I would have never have known that she went through the process.
and I think
that she
that's
went.
key.
And it really
you don't
is.
want people going like, oh my gosh, you have these lips.
One of the things that Dr. Parker had said to me is that the best compliment you can get is that people are just going to say to you, did you change your hair?
Did you sleep last night?
Did you look so, yeah, you look
Right.
rested, and that's exactly what has happened. So it's been awesome.
Yeah.
Did the experience meet your expectations?
Oh, it exceeded. Absolutely. Absolutely. I mean, she's awesome, absolutely awesome. And you know, you ask about, you know, the discomfort, and it's really, it's not bad at all. And I know everybody has a different threshold for pain.
Right.
Sure.
But when I look at the results, and it honestly, it was not what I would call painful. You know, uncomfortable perhaps, but not painful at all.
Now, what was it for you that made you want to do this? What were you not happy with
unhappy
about
about?
yourself?
I had this, it was like all had kind of dropped, and I had the huge line here, and it's like Dr. Parker said, it's the angry face, and it did, I looked tired. I mean, if you look at the before picture, I looked tired, but I didn't feel that way inside, and I want the outside. I mean, look at that.
So
It's disgusting.
it wasn't like they, well,
No.
I always feel like before pictures are so, you know. Whoa.
I'm not making it. She's our general sales manager, so I'm treading water lightly here, everybody.
I think the before
my
picture
job.
is beautiful.
Yes, gorgeous, fabulous. There you go. You use Fraxel laser, correct?
Yes.
And then it was also Sculptra. So talk about
what's Sculptra?
so
Right.
what
What
is
is
this?
Yeah, well, Sculptra grows collagen in our skin, and actually we're not even seeing the end results. Leslie's going to look even better 6 months from now, because the Sculptra is going to keep firming up her skin, growing more collagen of her own that will last for years.
Oh.
But the very first thing we did was little Botox and little filler injections. Little Botox to relax the angry lines, and, you know, when we weaken the muscles that pull down, and have stronger muscles that lift. And when we relax the frowning lines and let the smiling be strong, we look happier, we look less tired, we look less sad. And just with that alone, Leslie said she was already getting compliments after the very first
Isn't that
visit.
something?
People thought she changed her hairstyle, and we don't want neon signs that say
Right.
Botox, Botox.
Totally
We
agree.
want them to, you look good, I have no idea why, but you're looking great.
Yeah. So how long does it last? Like, does she have to have this repeated in so many years, or is this just, this is it?
You know, the filler injections, it's nice to touch up, add a little bit every year as you get older, because you're going to need more as you get older, and they wear off a little bit, but she'll never need to do as much again.
Okay.
Good.
Well, that's great.
Yeah.
And we only have about 15 seconds recovery rate. I mean, the fact that you've been doing this over the last month, I mean, it seems...
Have you been here, right?
You've been
Yeah,
here.
I didn't miss any work. Didn't miss a day of work.
So you look naturally
with
beautiful,
one thing,
you
I had
didn't
a
miss
little-
any work. There you go.
Absolutely.
The proof is in the pudding, so to
Yeah.
speak. Dr. Lydia Parker, thank you so much for
Yes, thank
showing.
you.
Yeah, yeah, Leslie.
I think
And that's and it's so brave of you. I mean,
Yeah.
bless you for doing what you did, because I think you've inspired so many of you, that are watching thinking, wow, can I do this?
Yeah, women and men. There you go. Thank you
Absolutely.
very much. Well,
So
if you
good.
want to face 50, 40 fabulously, if you just want to look great, the Parker Skin and Aesthetic Center in Beechwood, 216-464-7333, Willoughby 440-946-9080, or go to theparkerclinic.com for all the information. Again, thank you.
Thank you. I'm not gonna